Welcome back to the Morning Blend. Well, today, new treatments to manage MS. Dr. Mike O'Connor is a neurologist and medical director of Columbia St. Mary's Multiple Sclerosis Clinic, and Cheryl Blaszek is a nurse practitioner there. Nice to have both of you on this show.
Nice
Thank
to be
you
here.
so much.
Thank you.
I was, I guess, surprised to find out that 400,000 people, it's estimated, have MS currently in the United States, and that there are 200 or so new cases per week.
You know, that's true. Actually, those numbers are probably a significant underestimation. I think those numbers came out from the mid-70s. I wouldn't be surprised if it's 600,000 people in the United States that have MS.
And so many more in the northern part of the United States where we live. Are they still finding that there may be a connection between vitamin D levels and where we live, not getting enough sunshine?
You know, it might have to do with sun exposure, but it's certainly, there's a connection with vitamin D levels. That has been proven. And of course, every patient with MS or even at risk of MS should have their vitamin D levels checked and supplement vitamin D. So absolutely.
Good key. Let's talk about what new treatments there are right now for the management of MS. This is good news, I would think, to anybody who's watching today who's suffering with MS or knows someone who is. Right.
You know, in the last 2 years, there have been 3 new therapies that have come out for MS, and they're all pill form, they're all oral form, which was a real relief to a lot of patients that have MS, because before then they've had to inject themselves with the medication. So that's an exciting new development in MS, and these medications are effective. There is a pill that's also been out for the past 3 years that helps certain patients with MS walk better and function better. So that is also extremely exciting. On the wings of development and possible release by the FDA in the next year is another medication that is infused once a year, which is a game changer really for a lot of patients with MS, and it's very effective, the studies show so far. So this is a lot of excitement in the field of MS and for therapy.
And when we talk about helping with the management of MS, specifically what symptoms or problems are these new medications helping with?
Well, you know, the medications that I just mentioned are medications that help prevent future MS progression. Future MS attacks, help patients stay mobile, help patients stay healthy. And as the medications come out, they seem to be more and more effective, and that's really, you know, the exciting part of this therapy and the exciting part of MS right now.
Yeah, I would think so. Rehabilitation medicine, what is that, and what's exciting about that?
Well, rehabilitation medicine is used after patients have some sort of injury, insult, surgery, and in our case, our patients, despite the fact that they have treatments for their MS, still can result in relapses in their disease process and possible disability. So in addition to using medications, we also use special physicians called physiatrists that are trained to provide physical support, including physical therapy, occupational therapy, and speech therapy to help our patients get better after recent relapses.
I bet you've seen some great examples of patients feeling better and having more mobility, and that's very encouraging in your line of work.
Yeah, absolutely. And that's why we use rehab medicine in conjunction with the medications and treatments and such. It's a big part of getting people physically better, physically active, and keeping them engaged in their lives.
Well, and I think the better they feel physically, the better they are emotionally, spiritually, mentally. And I wonder about what you see as being some of the most important components of what you really consider to be a comprehensive MS clinic.
You know, a comprehensive MS clinic includes a lot of different subspecialties. So it's not just Cheryl and I diagnosing someone with multiple sclerosis and then advising them on what types of medications they may take specifically for multiple sclerosis. But, you know, a comprehensive center then would include subspecialties in pain management or urology. A lot of patients with MS have urinary bladder spasticity, and that needs to be dealt with by specialists. One of the fields of the subspecialty that we work with that we're very pleased to have is Sacred Heart Rehabilitation, which is excuse me, affiliated with Columbia St. Mary's. And that is where the physiatrists come in with the physical therapists, occupational therapists, speech language pathologists, even a neuropsychologist for, you know, the emotional and cognitive aspect of MS. And that's truly what makes a comprehensive center, and that's what we have at Columbia.
And I just think from a patient standpoint, to have all those specialists in one place is a wonderful gift, so that you're not going all over to try to get the care that you need.
Right.
I want to mention that coming up this Saturday, June 8th, you have a free seminar. It's a free multiple sclerosis community seminar. And the great thing about this is if you're currently suffering with MS or you know someone who is, you're welcome to attend this. It's a free lecture to learn more about new therapies for treating MS and its symptoms, to understand the role really of the rehabilitation medicine that you mentioned, as well as spasticity management, and to identify specific interventions from physical therapy, the occupational therapy you mentioned, and speech therapy too. So that again is happening Saturday, June 8th. It's at the Water Tower Medical Commons, which is located on N.Lake Drive in Milwaukee. It's the first floor conference room. And to register again for this free community lecture, what you need to do is call 414-963-WELL or 9355 to register, and there's that number there at the bottom of the screen. So nice to have both of you here today.
Thank you very much.
so much.
Appreciate
it.